Blood Purification Therapy, Lesson 2, Configuration of Hemodialysis Circuit. This unit covers the basics of blood purification therapy. The goal for this lesson is to understand the configuration of a hemodialysis circuit, and to learn about the functions of each component. This is the content of this lesson. These are the components of a hemodialysis circuit. We will go over the functions of each component one by one. The first component is the puncture needles. When dialysis is performed, blood is removed from the patient's blood vessels and returned to the body after the blood is purified in the dialyzer. Therefore, two puncture needles are used for dialysis, one for blood removal from the artery and the other for returning the purified blood into the vein. The puncture needle used in dialysis is a large 15 to 17 gauge needle to ensure sufficient blood flow. The second component is the air bubble sensors. The air bubble sensors are placed at the inlet and outlet ports of the dialysis circuit near each puncture needle. At the inlet port, air bubbles are prevented from entering the circuit through the arterial line. If a large amount of air bubbles enters, the blood will coagulate in the circuit, making hemodialysis treatment impossible. At the outlet port, air bubbles are prevented from entering the patient's blood vessel through the venous line. If a large amount of air bubbles enter the body, it can cause various symptoms such as shock symptoms and chest pain. On the exit side, air bubbles are prevented from entering the patient's blood vessel. When large amounts of air bubbles enter the body, they can cause symptoms such as shock and chest pain. The third component is the blood pump. The blood flow rate can be adjusted using the settings of the blood flow pump. The most common blood flow rate for dialysis in Japan is 200 milliliters per minute. The dialysis efficiency can be improved by increasing the blood flow. The fourth component is the anticoagulant injection line. Blood coagulation is activated when the blood comes into contact with a foreign substance such as the dialysis circuit. If the blood coagulation progresses, dialysis treatment cannot be continued. Therefore, initial or continuous administration of anticoagulants is performed in order to prevent this from happening. Heparin is the anticoagulant commonly used for anticoagulation of blood. The dosage of the coagulant must be carefully monitored because an overdose may cause bleeding. Heparin is the main anticoagulant used. Overdose is a risk of bleeding, so the dosage must be carefully monitored. The fifth component is the dialyzer. The dialyzer is often referred to as an artificial kidney and plays the main role in removing wastes, correcting electrolytes, and removing excess body fluid. Dialyzers come in a variety of sizes and materials, and must be used according to each individual patient. The last component is the blood chamber. The pressure line coming out of the blood chamber monitors the venous pressure changes in the dialysis circuit. Monitoring the changes in the venous pressure allows early detection of blood coagulation in the circuit, needle withdrawal, and blood removal failure. This is the end of Lesson 2, Configuration of Hemodialysis Circuit. Make sure you've mastered the basic concepts before you move on to the next level.